Hi ladies, it's Angela here, and I want to talk to you today about a topic that I think is really hot if you're in perimenopause, menopause transition, and that is the use of HRT, short for hormone replacement therapy. Many women will use this as the first thing to try and help them with symptoms they're dealing with. Many women think it will help them with their hot flashes, it'll help them to sleep better, it'll help improve their mood, it'll help improve their hair, skin, and nail health, and it may even help them lose weight. So I want to let you know with this, I'm going to break down the myths, because what can happen with HRT is the reason most women get symptoms as they're moving towards and into perimenopause isn't because the hormone levels are lowering. It's actually because the hormone levels are out of balance, and it's most typically fueled by inflammation, imbalanced cortisol levels, which was one of our primary stress hormones, and other hormones that are potentially out of sync and may have been out of sync for a long time. Hormones like insulin, other sex hormones that are usually fueled and out of balance, again, because of the root cause being inflammation. And what estrogen and progesterone does for us as females is it actually can mask some of these imbalances. So when we have abundant estrogen and progesterone levels, we don't feel like we actually have to do as much in regards to lifestyle to maintain ourselves feeling well. But as those hormone levels start to plummet, guess what? Those imbalances that have probably been there for years, if you haven't been leading an optimal lifestyle, start to reveal themselves and you become more symptomatic. And again, what can happen if you add HRT into the mix when you're starting to get these perimenopause, menopause common symptoms, lack of sleep, insomnia, waking up in the night, not being able to get back to sleep or struggling to get to sleep. I know that's a huge one for many women. It can be tied into hot flashes, but not always. Mood shifts. They can be all over the place. They can be irritability, really any day or time of the week, but often women are also suffering with low mood and even times of anxiety and even panic where they never have in their life before. A lot of women report weight gain, especially around that midline, and they think that HRT is going to solve all their problems. And I want to let you know that if you have imbalances in your body where you are suffering from a laundry list of adding in HRT, whether it be bioidentical or synthetic, is like adding fuel to a fire is what it is, because the body has to be able to utilize those hormones properly. And you've gotten lots of feedback from your body already that it's not utilizing the amount of hormone that you have properly, even if it's lowering, because not every woman that moves towards and into menopause is symptomatic with all of those things that I mentioned and then some. So if you are feeling like you do have a lot of symptoms, the first solution is to understand where the root cause of those symptoms is coming from, which hormones actually are out of balance, and which ones are the primary root cause. It's not ever going to be just estrogen and progesterone, just an FYI for you. And from there, you really need to zone in on a customized lifestyle plan, which a practitioner like myself can help you understand what to do and prioritize to get the balance back in the body. Most women need to get the balance back in their adrenals, their cortisol, their stress resiliency. Most women need to do some strategies around nutrition and lifestyle and exercise, and this in turn can also help you to sleep better. You may even need to address something like an underlying thyroid hormone imbalance, which you may or may not know is there, but it could be contributing to a lot of the symptoms that you think are tied into estrogen and progesterone levels being lower. So again, the first step is to figure out what is the root cause of these symptoms. It's not just because your estrogen and progesterone levels are lowering. If it was, every single woman would be suffering greatly as they move towards and into menopause. And there's cultures in the world where they don't even really know the term or the word menopause. They know there's a point where the period stops, but they're not having all these symptoms. So we've really got to think of this is not due to the menopause shift. This is due to imbalances in our body, and the lowering of the hormones triggers the symptoms because we're so out of balance in our bodies. So we've got to get the balance back. Some women actually are more hormonally abundant, and they start out that way in life. Some women have more curves, they have bigger breasts, they have a little bit more roundness around their bum, and some women have much more slight frame, they're small boned, they have small breasts, they don't have as much curvature in the hips and around the buttock area. So these women are not as hormonally abundant as other women. Point being is that often women that have a lot of hormone in them naturally are not good candidates for HRT necessarily as they move towards and into the menopause shift, meaning hormones we're not naturally producing on our own at high enough levels for some women as they move towards and into menopause. Individually, some people are good candidates for HRT, Some people are not. Some people may become good candidates for HRT once they get basically all the ducks lined up in a row and they have their lifestyle optimized in every way possible so that if they take on HRT, the body can utilize it properly. I've worked with so many women on the other side of HRT that they've gone on to it, and a few months, even a year or two later, they're full of symptoms that are side effects from using the hormones. And the reason for this is because the hormones build up in the body, and the body, if it's not utilizing them properly because it's out of balance, not metabolizing them, it's not excreting them when they need to be excreted, it's actually recirculating hormone and depositing it in different areas of the body where it shouldn't be, like the liver, women start to become symptomatic. They report the exact same symptoms that they were having before they went on the HRT. And again, it has to do with the imbalances that the body is just not utilizing hormone correctly in the first place. So don't think HRT is going to save the day for you. Again, I hate to burst your bubble, but if you are using HRT right now and you're finding that it's working for you, don't think that it's never going to be the case. I've seen it time and time again for women that are not on HRT and considering it. You can have symptoms either way if you don't get the body back into balance first. So we've got to figure out your sleep. We've got to figure out your stress. We've got to get you eating properly. We've got to get you on a consistent exercising routine. The basics have to be in place first. And sometimes we need to go even deeper than that. And we need to look at the health of your gut and your liver and your detoxification pathways. And if you work with a functional practitioner such as myself, we can dive into the lab testing that helps you understand how well is the liver and the gut metabolizing, getting rid of toxins, mobilizing and moving hormones to where it needs to get to. So we can really customize what needs to be done for you and your body and get you on a proper lifestyle so that you can have healthy longevity for the long term and not be at risk for disease processes. I do feel like there is this fear factor going on, and I think social media is driving a lot of this fear-based putting HRT in the body to prevent all of these things from happening to you down the road, like heart disease, neurodegenerative brain issues. But at the end of the day, there's no point in putting HRT in and trying to look for the benefits if the body can't even do what it's supposed to be doing with these hormones. They're always going to be different coming in, whether they're bioidentical. So don't be fooled into someone telling you it's 100% natural because it's bioidentical versus synthetic. Because anything that comes in from the outside that's hormone is always going to be different than what we produce on the inside. So we really, again, need to make sure that the body is able to recognize and use what we bring in from the outside. And the only way this can happen is if the systems in the body on the inside are balanced before we bring something in from the outside. You may or may not be a good candidate for HRT. You may not be on it yet and you're thinking about it. You may already be on it. Either way, you've still got to be contemplating these same things that I'm talking about. How is your lifestyle? Is it dialed in enough? And you may not even know what that means. We don't know what we don't know until we work with a practitioner that can help us zone in on where. And we may need to lift the hood up of the vehicle and start to do some proper lab testing to understand where you truly are out of balance. The second thing is, are you actually someone who needs HRT to transition into menopause? One thing to consider that this does is it does lengthen out that transition, especially into menopause, because you keep yourself at a hormonal level where you're not totally in menopause, right? And is that natural to the body? And are we meant to do that? At some point, people do come off HRT. You're not going to stay on it for the rest of your life. So we've got to be thinking, is this just a quick fix? Is this a Band-Aid solution? Or is this something that's truly going to help you and your body transition into menopause well and potentially decrease your risks of disease and improve your longevity and overall quality of life for the long term? Again, this is not everyone. I definitely call that out as a practitioner because I work with women that have hormone imbalance all the time, that are before menopause and after. And I know HRT is not the answer for many women, and a lot of women find this out the hard way. There is some women that are good candidates for HRT and that do well on it, but it's very individualized. So you really have to work with someone to understand when and if this might be you. So I hope this helped you to understand the benefits, the pros and cons of using HRT versus not. Do you need it? And are you at the right time to look at utilizing it? So if you do want to reach out and learn how to develop an individualized plan to help you get your body back into balance as much as possible before you become a potential candidate for HRT or not, to improve your overall quality of life, both now and for the long term as you move into that perimenopause, menopause transition, please feel free to connect with me. Again, my name's Angela. I'm a functional practitioner. I have been working in the field of women's health for over 20 years. It's not all about hormones. It's not all about HRT, that's for sure. There's a whole lot that can be done to live a healthy, long life regardless. So again, if you want to connect with me and this resonates with you, it may match your value system, please feel free to reach out. You can go to my website, www.angelasimpsonfunctionalmedicine.ca. There is a place there to click, and on the contact link, you can either send me a message or you can book a free initial complimentary consult on Book Now. The other way is you can continue to follow me here through my socials. So if you haven't already liked me on my YouTube channel, Angela Simpson Functional Medicine, please give me a thumbs up. If you haven't joined my Facebook group yet, Functional Medicine for Hormonal Imbalances, please ask to join. There's over almost 7,000 women in that awesome group supporting each other and learning about how to rebalance their hormones naturally, especially as you get into your 40s and beyond. I also have a TikTok channel and Instagram, and you can check out some of my reels there too. And again, on my website, you can search the blogs there, and there's lots of different posts and information. Probably you'll find something that is of interest that resonates with you and your symptoms in regards to hormone imbalance and symptoms as you move towards and into perimenopause, menopause, and beyond. Thanks, ladies. Nice to see you. I'll see you again soon. Bye for now.